Namaskar. Welcome to BAGC seminar program. I am Deepak Ghosh, coordinator for the seminar program for BAGC. Tonight's topic is taking care of your mental and emotional health during COVID-19 pandemic. Many of you may know that we started the seminar program for BAGC senior members almost 3 years ago. We did that once a month at our Bongo Bhavan building. Then the whole thing changed in the world. The world got hit with coronavirus, COVID-19 pandemic. The monthly program was cancelled since March 2020. I'm very happy to announce tonight that with the encouragement of our BAGC president, Jayanto Mukherjee, I have restarted this seminar program virtually for entire BAGC community, not just the members, senior members anymore. The topics we will be selecting will be applicable to almost all the members of BAGC. COVID-19 pandemic presented us with many challenges. We are specially isolated. We cannot see or physically meet our friends and families. Those who are working from home or the senior members are essentially homebound, are experiencing many physical, mental, and spiritual health problems. So BAGC will be bringing expert speakers in all those areas to give us valuable information and guidelines to help us with some of the issues. Specifically tonight, seminar topic once again is dealing with your mental and emotional health during COVID-19 pandemic. We have an outstanding speaker for you tonight. Our speaker tonight is Dr. Jhilam Biswas. Dr. Jhilam Biswas is the Director of Psychiatry, Law, and Society Program at Brigham and Women's Hospital and serves on the faculty of Harvard Medical School. She works in multiple different settings as a psychiatrist and sees patients in emergency department within the hospital, in correctional settings, and in college health centers. Dr. Biswas has seen the impact of COVID-19 pandemic on various populations across the community. She serves on multiple psychiatric communities, statewide and nationally, and specializes in the area of treatment of serious mental illnesses, trauma and resilience, violence and suicide risk, and cultural competency in mental health care. BAGC members, it's my distinct honor and privilege to introduce to you Dr. Jhilam Biswas.
Thank you so much for that introduction. So this is my distinct honor to be able to speak with you today on a very important topic, given what everyone is dealing with today in the world with a pandemic. And while we are all very focused on everyone's physical health and well-being and safety, so much of the unseen problems are around our own mental health and stress. And what Dr. Ghosh said about my background, I do see a lot of people in various social settings like prisons and jails. I work in a college health center and I work at a tertiary care center, Brigham and Women's Hospital. So I see a lot of people, and I have a lot of colleagues who are dealing with individuals in older communities and senior centers, and across all of these social systems, we're seeing a lot of problems that are sort of underground right now, but will probably be issues that we'll be managing for the years to come after this pandemic. And so I really appreciate your attention on these problems, and hopefully we can talk about ways for you to be managing some of your mental health. And what I want to bring up in this conversation first is that the mental health toll is large, and the things that my colleagues and I are seeing across the board is just a heightened level of anxiety. There's a lot of issues around the fact that we have large communities of people who are unemployed, and so have some really serious financial strife. There are people who are right now in the working world who are overworked. Anyone in the healthcare profession will know how much stress there currently is in working in healthcare, and that's about 20 million people in this nation. So that's a lot of people who are really dealing with being overworked. The whole working from home culture has been very stressful for people. It's not a routine thing for people to do. There's no transit time between Zoom calls and meetings. And so, oftentimes people are going straight through the day working with no real breaks. Another big problem that people are dealing with is sort of the lack of privacy. Just because anyone can reach you at any time now virtually, people are using that to their advantage. They're contacting you at different points in the day that might be not circumscribed to the workday, and that can be stressful. And so, beyond just the stress of daily living, we're going to be talking about multiple other topics that people are handling in terms of their mental illness and mental health. They're going to be, we'll go beyond anxiety, and we'll discuss grief and processing grief, because that's another big piece of this conversation, is that the pandemic is causing many losses in people's lives. And those losses range from, the tragic number of people who've died. We're over 300,000 people at this point, and each one of those individuals has a family that's grieving for them and isn't properly able to the loss, because we can't have funerals and we can't have the regular ways we were all dealing with grief. People are missing major milestones in their families' lives, which can be a big loss: graduations, weddings, funerals. So this is really something that we need to talk about, because it is going to be a process to manage all of the mental illness toll that this whole pandemic will take. So I just wanted to bring that up before we get started. And I want to speak to you about what we're going to talk about in this conversation. So in the talk, we're going to first deal with what are the statistics and what we're seeing in terms of people's mental health and their deterioration of mental health during this pandemic. And so you have a baseline. And then we're going to talk about detecting stress within yourself and loved ones, other family members, so that you can kind of help someone in your life if you feel like the stress is getting to them too much. So we'll look at red flags for people. We're going to discuss processing grief, and because for so many people, there are so many losses in this pandemic. And we're going to also then move to discussing what is the difference between poor mental health related to the pandemic and serious, and what is mental illness, and what to look out for actual psychiatric problems that might need a little bit more than self-care. So we'll discuss all of those pieces in this conversation. First, let's just kind of take an overview of what's going on. Will the pandemic have the same trajectory as other disasters? Disasters are as old as mankind, and there is a very specified psychological process that people go through in disasters. And this is a schematic of or a mental health chart that's based on preventative medicine principles and what we see in disasters like hurricanes or earthquakes, and how people manage. And so you'll see on the vertical axis emotional highs to emotional lows, and you'll see on the x-axis you'll see time passing. And so what we first see in disasters, and again, the pandemic is very different because it's not one specific locale that's dealing with the disaster, it's the whole world. Everybody is dealing with the same disaster at the same time. It's also much longer than any other disaster that we've really dealt with in the past decades. And so it's important to realize that this is going to look different. And so pre-disaster, the emotional strain is sort of in the middle. It's not emotionally high or very low. You get the warnings from the news, you get the sense of something, this impending threat. And it's sort of your emotion slowly starts to decrease as you kind of get prepared for the threat. And then the impact hits of that disaster. And so what's really interesting here is after the impact of the disaster, oftentimes we don't see a huge depression or angst. We actually see people's emotions improving in the sense that there's this community cohesion, there's these heroic efforts, everybody is talking about heroic measures that local communities are taking, states are taking, the government is taking to help. There's a sense of helping and community cohesion. And that sort of peaks at that honeymoon stage where everybody's all hands on deck, working together, using their resources, pooling resources together to help each other. We sort of saw that in that first wave of the pandemic when it was specifically focused in the northwest of the country and in the northeast where the numbers were very high. And so there we saw these heroic efforts, and there was this community cohesion around locking down and everyone's social distancing and not being tired of the whole process. And that's that period where you see this between the heroic stage and then when it goes downward, that's when people are taking inventory and taking stock of what just happened in our lives. After the honeymoon period, as time wears on, there begins this decline in emotional well-being, where slowly you're starting to take inventory of the impact of the disaster and what's really happening. We haven't fully gotten there actually in the pandemic, but I do want to point that out that there's this decline, but we are somewhat in the decline from the first surge, and now we're dealing with the second surge of coronavirus, which is particularly difficult when we're already disillusioned from that first stage that we experienced. And so in that disillusionment, we'll have trigger events. Some positive things will happen, some heroic efforts will happen. There'll be ups and downs in the emotion, but pretty much there's sort of a low-level depression after a disaster is resolved and the basics have been put in place. There's sort of this low emotional state that people experience for a long period of time. And if you look at the x-axis at the 1-year mark, things start to improve over time after everyone's taken stock, and there's an anniversary reaction. So, maybe we'll see this in the pandemic, that every March we'll have a taking stock moment of what's happened to us in 2020. But there is an anniversary reaction to a disaster, and there's a dip in mood. And then after that first anniversary comes a reconstruction period. So this period of time, it's like a new beginning, where we're rebuilding again, where we know the disaster is behind us, fully behind us, which we're not there yet. And then, there is this finally of space and time for people to work through their grief. And so that's where a lot of the grief processing happens of all the losses. And unfortunately, we're in this situation in the pandemic where we have not been able to really come to terms with what's happened, because here we are again, going through the same period of distress and stress during a holiday time, and we really haven't been able to process grief. We have over 100,000 people hospitalized. We know that hospitals are really strained at this time across the country. And the other problem is we don't have other communities coming to our aid because everybody's in the same situation. So that's another big difference in the pandemic that may impact people's mental well-being in a different way. So I just want to point this out, that this is sort of how psychiatrists and psychologists will think about how to deal with mental health problems for communities when they go through a disaster. But of course, this is a very novel situation that's going on, and we're going to have to look at it differently, and we're going to have to be more creative, and we're going to have to really engage the community in coming out and dealing with mental health issues. So that's something I wanted to show you. So this is from the Lancet Journal, which is a very important journal in psychiatry. There's the Lancet Psychiatry Journal, and the emotional stressors of quarantining. So this is kind of what we've all been dealing with short breaks, but not really much breaks since March. And so what are some of the stressors that people are experiencing? And this article is written late spring, summer, so it might not even pick up on kind of our fall, winter mentality of what's going on. But the duration can cause a lot of stress, the fear of infection, frustration and boredom from not really being able to plan ahead and have things to look forward to not be able to get projects that you were doing done because of, everything being stalled. So that can be an emotional stressor for sure. We're going to talk a lot about that. That in combination with loss of routine can be very stressful for people. If you don't have your basic norms, in place, and you lose your routine, and then on top of that, all the things you were working on are kind of put on the back burner, and you're not able to really engage in a lot of the projects you were doing, and then you're just stuck with all this time to figure out what to do with yourself, that can be very stressful. A lot of people are experiencing a loss of social supports and isolation. And so this can be a big emotional stressor. Human beings are social creatures. We were meant to live in big groups and deal and manage in our communities, like the Bengali Association of Greater Chicago. This is a big community that helps each other, get through difficult times. And I'm glad that we're doing these virtual sessions. It's a good way to get people together, but there is this isolation where people cannot actually just see and touch and be near each other. And that can be a stressor that you might not necessarily feel in your head, but does impact your sense of support and self. Inadequate supplies, inadequate information, new disease. We don't know the impact of the vaccines that, we know that they're amazing, but we don't know everything about the treatment. We don't know everything about the virus. So that is actually very stressful for communities at large. The stressors are very difficult, and the stigma. There is a lot of stigma that people are dealing with right from the very beginning of this pandemic, when people, a lot of Asian Americans have dealt with stigma around the fact that this virus originated in China, and a lot of Asian Americans have had a lot of stress from dealing with this stigma too. So I think it's important to think about all of the different factors that are in play. And so there was an American Psychiatric Association poll that looked at across the board, asked lots of different people from around the country, like, what are your reasons for anxiety right now in the pandemic? And 40% said that they were anxious about getting seriously ill. And even more so, 62% feared that a loved one would get the disease. 36% were anxious about their own mental health. 59% feared daily impact on their lives and work. 50% are anxious about running out of food or medicines. Again, this was from spring, early summer. We don't have the data on the fall yet. So at that time, grocery stores were emptying out, and there wasn't any toilet paper and all of that. So there was more fear in those realms of life, which I think has abated some at this point. 68% worry about the longstanding impact on the economy. 19% report trouble sleeping, and 12% report more fighting in the household. We're going to talk about that. That is something that can come up when people are stressed. And so the Kaiser Family Foundation Health Tracking Poll is one of the largest polls across America that is looking at the health of the population during the pandemic across all demographics and genders. This pandemic has been very disruptive to people's lives. So most Americans across demographics say that their lives have been disrupted. Now, I bring that up because disruption can be extremely stressful for people, and that's where a lot of people's stress are coming from. And so you can see across the board, but particularly for minority groups, the stress is very real. And the disruption in their lives is actually more intense. And actually, the highest percentage is parents and women. This goes without saying that, people with children are really dealing with a lot of stress and a lot of uncertainty around what's going to happen with their children's schooling. What is the impact of this remote learning year? How to take care of kids and also manage a job and be available, mentally available for both of those things. It's almost untenable. It almost doesn't make sense. It's a nonsensical situation that people are in and having to make sense of it. And so that has been very problematic. And parents in general talk about, this is a major disruption in their lives. They're dealing with raising children in a pandemic. So that's big. And so amidst the coronavirus crisis, Americans are already suffering. This is another poll, and I just want to give you a baseline. And there's this fear for the future, I think, that people have, this existential fear. And so 72% say that it's disrupted their lives a lot or some. 39% say they've lost a job or income during during 2020, which is extraordinarily stressful given the food insecurity issues that we're seeing across the country. If you don't know when you're going to eat next, that's like a basic safety issue that causes a lot of stress. 45% say it's affected their mental health negatively. 74% say the worst is yet to come. And so that's, people are not feeling very optimistic right now. I would say this was right before we knew that they were approving the vaccines. And so things have somewhat shifted, but it's important to note. 79% worry the pandemic will trigger a recession, and 82% fear that the nation's healthcare system will be overrun. And we're actually watching that happen before our eyes, that our hospitals are filling up and our ICU beds are filling up. So that's very stressful. And so how do we recognize stress? So now we talked about all the reasons that people are stressed, and this is very real. And like 3/4 of our country right now is dealing with various stressors that make them worry about their mental health. And so we need to become more literate in emotional intelligence as a community, as a nation, as in our groups, because and we need to reduce the stigma of having mental distress that may result in disease. And I think that this is a time that this may be a really amazing opportunity to reduce stigma, because everybody is experiencing the same stressor at the same time. And so let's talk about ways to recognize stress. And some of this may seem very obvious, but when you think about, sometimes we don't put all of it together. Sometimes we realize, I'm feeling, I am feeling anxious, but they don't necessarily notice that there's all these other domino effects to that anxiety that are happening in their life. So I'm just going to go through it so that you can kind of notice within yourself if any of these things are happening, or within family members, and so that you can point it out and actually do things to relieve that symptom. So there's 4 components to stress awareness: the emotional component, the cognitive component, the physical component, and the behavioral component. And so emotional signs include feeling anxious, like we talked about, feeling frustrated. If you notice that your frustration tolerance is just really decreased, that you just kind of have outbursts for things that you would not have outbursts about, that's a red flag. Just being irritable all the time, being sad in general, feeling numb. This is a harder thing to kind of pinpoint, but when you just feel like you're just hearing things that are really tragic from other people and you just have no emotion to it at all, and feeling overwhelmed, that's a very telltale sign of emotional distress that you can pick up on, or family members can pick up on. What are some physical signs that those emotional signs can cause? Low energy, not feeling motivated to do anything, not feeling like you can kind of get your day started and feel energized to get through all your tasks of the day. eating changes where you're not hungry, or you're eating too much, you're trying to, deal with the stress and there's nothing else to do, you're eating. Sleeping problems. Are you sleeping through the night? Is it taking you a long time to fall asleep? Do you find yourself waking up through the night because of anxiety or your mind racing? Moving more slowly. That's another area that comes from low energy. You just don't feel like you can kind of get through the day. Muscle tightness, stomach problems, pain, where you're a lot of times emotional distress can make pain in your physical body just make you feel hypersensitive to pain, and can make pain more intense. So that's something to keep in mind. There are cognitive signs to stress. So having a harder time thinking. If you feel like you're just standing there and you can't remember the next thing that you're going to do, and this is happening a lot, that's a cognitive sign that you're dealing with an overwhelm of stress. Difficulty concentrating and struggling to focus on tasks. Like when you're getting through something, it's very hard for you to kind of stick to it and actually get to finish it. That can be a sign of stress. And then we have behavioral signs. So withdrawing from others, not wanting to engage with other people, not even wanting to reach out. This is a good time actually to think about these behavioral signs, because it is the holiday season. If you're not feeling like reaching out to any of your friends or family that are outside of your household, and that's notable for you, then I think, you should think about, am I stressed out? Am I not dealing with stress in a way that's going to help me get through this? Taking risks you usually don't take, getting into arguments, overusing substances. Substance use is a big problem that comes from not feeling good. A lot of times when you're not feeling good and you're not feeling good about your reality or the situation around you, substances can feel like a short-term reprieve or retreat from your life and a way to deal with it. It's fine, it depends on what you're using, but if you're overusing over time, it can have some really detrimental effects, not only on your physical body, but on your mood, on your well-being, on your motivation, on your energy, on your ability to sleep and eat and have a routine. Substances can mess all of that up. So just keep an eye on if you're overusing substances. The other problem is there's a huge rate of overdosing happening across the country right now in the middle of the pandemic. It's sort of in the shadows of the news cycle. We're not talking about it as much because there's so much to deal with in the news, but it is more serious. And that part of that is because people are not using substances correctly and are self-medicating their pain. So nice slide to just talk about quick tips of what ways to cope with COVID-19 just in the moment. So, one thing is take breaks from the news. I think this is difficult to do, especially because we're using screens so much at this time. And so when you're using a screen, you're getting notifications constantly about news cycle stuff, that what's going on, what's going on politically, what's going on economically, what's happening in the world of health. So take breaks from the news. And if that means separating from your screen or shutting off all your notifications, do that. And then making time to unwind, especially if you're struggling with sleep, it's really important to have good sleep hygiene. So making time to actually set aside screens, do something that's relaxing, like reading a book, something that won't attack your concentration like our screens often do. Set goals and priorities. What are some things you want to do after the pandemic? What are some things you want to get done this week that's going to help you get through? Just have a planner, write down a few goals for each day. And then as you start completing your goals, you start to feel more motivation because you're kind of getting the momentum back in your life. So that's a good way to separate. Take care of your body. Think about exercise as if you're taking a medication for depression or anxiety. I mean, taking care, just exercising releases endorphins that improve your mood. And so whatever type of exercise gives you that connection to your body and that endorphin release that lifts your mood is a good idea to do at least 4 to 5 times a week. The recommendations from doctors have changed around exercise. It's important now. It used to be 3 to 4, but now it's 4 to 5 times a week to be exercising at least 1 hour. And something cardiovascular related is always very good for your heart and head, actually. And so connecting with others is a really important way to lift your spirit and to stay connected. We are social beings, and focus on the facts. There's a lot of information out there that's not true. And that is really affecting our fears about the world. And so just make sure that when things sound a little bit too crazy and too out of control, just make sure you know the facts of what you're listening to. And so actually one thing I wanted to bring up is, okay, so this sounds like, okay, well, those are good tips, but how do I get through this? And what I would say is that most people are going to do well through this pandemic. People go through disasters. This is something that has happened on and on through the history of humanity. We have dealt with disasters, and most people do well. And, there's been a lot of studies at looking at who manages stress well, what types of people manage stress well, what are the traits in an individual that help them. And we have found that there are these traits that build resilience. We call that being able to manage stress over time as resilience. And these are some of the traits that we see in those individuals. And we're going to talk about ways to kind of, and we've already talked about some ways, but how to enhance those traits. So optimism is an important trait for people who are resilient, and focusing on your own strengths, focusing on the strengths of your life. Attitude to life, focus on action. It's instead of ideas and thinking about things and overthinking about things, just start putting things to action. Whatever thing you were wanting to do, however you want to go about it, put it to action. That's a trait of resilience. Emotional awareness, key to good communication. So being aware of triggers for stress that we talked about, the cognitive, behavioral, emotional, physical. So be aware. Being able to control your response to circumstances. We can't control the circumstances around us, but we know how to control, we learn to control our reaction and our response to stress. And so be very mindful of how you are dealing with difficult situations, and if there's some way you can change your response. And that can really affect the direction your mind takes that day. Social supports, like we talked about, are a great way to be more resilient. Having a sense of humor and laughing at life's frustrations can be a really nice, important, it's just a very important trait for resilience. Self-belief, believing you can get through something, having that confidence, having a high self-esteem. These are important traits, and ability to problem solve and willing to be flexible. So these are just traits of resilience, but remember, these are things that can be learned over time. If you kind of commit to some of these traits, these are the things that will help you get through stress, but these are things that you need to learn. And we'll talk about ways you can learn them. So self-care is an important way to embody the traits of resilience. So what are some things we can do in terms of self-care in stressful times? Anchor yourself. So we talked about routines. This is a major disruption of routine in people's lives, and that is extraordinarily stressful. So what are good touch points through the day that can help you build a structure into your day and have a schedule? So waking up at the same time, going to sleep at the same time, having your meals at the same time. Those are really nice anchor points to create structure in your day, eating and sleeping. And then, some routines and habits and rituals that you do throughout the day, whether it's making your bed first thing in the morning and to get you started for your day, or in the afternoon doing a meditation, or if you have kids, touching base with them in a certain way through the day, having dinner with them at the table with some conversation. That can be a really nice anchor point for people to build structure and can really improve your mood. think deeply about what brings you comfort and then insert them into your routine. So if you're feeling very stressed and you're trying to build structure into your day, build a structure that feels good. So for people, it's lots of different things, but here are some examples. Putting in, music, candles, meditation, dancing, positive movies, exercise. So do things that bring you comfort and joy. Making tea at a certain time and having tea time and touching base with a friend during that time can be very comforting and important to building into your routine. Find ways. So next is finding ways to connect with family, friends, and colleagues. That's another thing. Social support. Maybe you have a Zoom group that you get together with 3 or 4 people, or friends you haven't seen in a long time, pulling them together to chat or have a cocktail hour or some kind of party. I'm sure a lot of you are already doing that, and hopefully you're doing that through the Bengali community. But I think that because the duration of the pandemic is so long, it's hard to keep doing it, but having a routine around it is nice. And then you start to bring that routine and structure for others that you love in your life as well. So that's nice. Educate yourself about the situation happening around you and know your risk. Know your local risk. Know, even if the national news is horrifying, know what's going on locally for you. And at different points, it may be less risky. And at that time, you can kind of enjoy yourself and do certain things that bring you joy. Other ways to get anxiety out include journaling, goal making, really having some plans. Plan for what you're going to do after the pandemic. Plan that trip. Decide where you want to go, have those conversations with the people you love, and start imagining it, visualizing it, and kind of manifesting it into being. Being future-oriented is also very helpful in self-care during stressful times. And also think of this as a special period of time in history where you all of a sudden have a chance to catch your breath and maybe engage in that special forgotten project that you never got to do, like making a photo album for your family, or putting together, a shed in your backyard, or whatever that project may be for you. So maybe get to some of those forgotten projects and make a bucket list, a pandemic bucket list, and see if it's a nice way to kind of shift the way you're thinking about things. And one quick trick that I do want to bring up in this conversation is belly breathing. And many of you may already know a little bit about belly breathing as a way to reduce stress in the moment. But if you're noticing you're very stressed or panicked and having an experience of anxiety, things you can do is taking yourself from your sympathetic nervous system, which is the fight or flight, fear-based nervous system that helps you get out of very stressful situation, and evolutionarily makes a lot of sense, but can cause us panic when it misfires. From your sympathetic nervous system to your parasympathetic nervous system, which is rest and digest. It's the way your body relaxes. It's the nervous system that runs all the processes in your body when you're relaxed, is through the slow exhale. When you breathe and focus on your breath, and you breathe slowly and you make sure your exhales are very, very slow, that's when you turn on your parasympathetic. So if you're in a moment of panic, here is a good way to do belly breathing. So you sit in a comfortable position, you close your eyes, breathe in slowly. When you breathe in, count to 5. Feel your belly fill with air, and then you breathe out slowly through your mouth. And I would suggest when you're breathing out through your mouth, count to 7. So the breathing in is 5, the breathing out is 7. And you repeat the cycle 5 times. If you can do 5 breaths like that, where it's you count of 5 in and a count of 7 out. So 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5, 6, 7. You turn on your parasympathetic nervous system when you do that. and it can reduce your level of panic in the moment. So that's a little trick to help get through. Okay. I'm gonna switch gears a little bit and talk to you about grief. So this is something to keep in mind as we talk about the pandemic. There's a lot of loss happening in people's lives, and processing the continual losses of this pandemic will be it'll just be a process for each and every person, because everybody has lost something in this whole process. And grief is like an ocean. It comes on waves, ebbing and flowing. Sometimes the water is calm and sometimes it is overwhelming. All we can do is learn to swim. And I do want to bring up grief, particularly for people who have lost somebody in the pandemic or have had somebody in the ICU setting and not being able to talk to them and having to go through doctors and nurses to be able to engage with their loved ones who they can't actually see and hold. This is an enormous grief. It's a tragic situation people have been put into. And on top of that, the fact that people are not able to have proper funerals for their loved ones is a deep sadness. It's a sadness that almost cannot be processed in the normal way grief has been processed, especially for individuals who might not be close family to somebody who has passed away, but might be a good friend and weren't able to give their last goodbyes or even join in the funeral process. That goodbye process has been curtailed for a lot of people. And so we do need to talk about grief in many different ways as we kind of go through this pandemic. And just want to say that there are stages of grief, and many of you may have seen this schematic before because it's become very popularized. But it is the process that everybody goes through, actually. And each phase may be shorter or longer for each person, but it is kind of this cycle that people go through. And I just want to point out that denial is that first stage. And what denial means is real, like not that you're pushing away reality, but you can't even fathom in your psychological mindset that it has happened. Like, it doesn't feel real. It's not, you can't actually believe that that's happening. You still think you can call that person on the phone or your loved one on the phone. And so denial is very real and it can last for a long time. And then there's the anger piece of feeling really angry about how things happened, or feeling angry at the person or feeling angry at yourself. Depression is the third stage of grief. Bargaining is the fourth stage, where you say, why God did you not take me? Why did you take, my wife or my husband or my child? It's this bargaining process that goes on before you actually get to acceptance. So there are 5 stages. It is very normal to go backwards and forwards through these stages. And it's also important to remember that sometimes when you lose a loved one, it actually, the grief never fully goes away, but becomes manageable over time. And it is time that really is required for this process. And I think as we go through this pandemic, we have to remember that it's gonna take time, that there is no magic pill to deal with the grief and loss that people are dealing with. It's going to take time and years to deal with what happened in 2020. And so one thing to keep in mind when addressing the mixed feelings of grief is it's very normal to feel 2 opposite feelings at the same time when you're feeling grief. We want to hold on to grief, and we also want it to go away. We want to go on and move on with our lives, but we have little enthusiasm for anything happening in life when we lose a loved one. We need other people. We need them to support us, but it also feels very hard to connect with anyone when we're going through grief. We know that person that we love has died, but we also have trouble even understanding that it's real, and that's sort of that denial phase. We crave connection to our loved ones, but we also avoid reminders of losing them and avoid even trying to think about them because of the pain that that can cause. And we can't stop thinking about the person who died, but we also feel like we've lost them forever. And so there's this very conflicted, paradoxical experience people go through in grief, and that comes in waves. And so it's important to realize that if you are feeling all of this, this is a very normal experience of grief. And processing grief, again, this talk is not meant to really cover everything about grief, but it's just to make you aware of some of the things to know when you're helping loved ones or friends go through this process. It's just to touch on the issue because it's so real. Only time allows feelings to surface. There's no normal way. There's no normal way to manage grief. It's just not linear. It comes in waves, it's up and down, it's backwards, it's forwards, it moves. It doesn't move linearly. And so over time, it can become something that can be dealt with easier. Connecting with others can be helpful, even if you're not feeling like doing that or talking to anybody about your situation. Finding healthy, caring ways to distract yourself. You may feel guilty about distracting yourself, but finding good ways of doing that is okay when you're trying to deal with grief. And keep telling their stories. The narratives are so important. When you're losing someone to grief, especially in this world where we're not able to all come together to celebrate people's lives after they go, it's going to be important to keep telling their stories and learning to live with the reminders of them in your life, and finding constructive releases for anger. What are some ways you can deal with your anger without, hurting anyone or hurting yourself or affecting loved ones? And feeling a sense of connection to the memories of the person who died is also very important. Keepsakes and ways to tell stories about yourself and about your loved one, and also creating keepsakes that you can remember your loved one by can be a way to process grief. Journaling is another way. Writing things down, looking at pictures, putting picture books together. Okay. So I just wanted to touch on the grief piece. Our brains can't fully grasp death in a short period of time. It takes a long time to think about these things. I wanted to touch on that. It's a very big topic. And if this is what you're dealing with, then I would suggest there are a lot of grief groups that are happening across the country and in your community, most likely, that you can be a part of so that you can deal with this with others who are going through the same thing. So we just talked about stress and self-care tips. So how do we manage things that are well beyond stress? When it's a mental illness and no longer just stress, how can you tell? So I want to bring this up, and I think it's really important because the CDC guidelines do talk about mental illness, and they give tips on how to manage this. However, I think it's important for people to understand exactly what mental illness is and what it is. What does mental health mean, and what does mental health and well-being mean, actually? Because we use the words mental health and mental illness interchangeably, and they're different. A person can experience poor mental health and not be diagnosed with a mental illness. Likewise, a person can have mental illness, a diagnosis of mental illness, and have periods of physical, mental, and social well-being and be well while having a mental illness. So they are different terms, and it's important to know the difference. So mental illness affects a person's thinking, feeling, mood, or behavior, such as depression, anxiety, bipolar disorder, or schizophrenia. Such conditions may be occasional or long-lasting, which is what doctors call as chronic, and affect someone's ability to relate to others or function in each day. What is mental health? Well, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. So again, poor mental health and mental illness are not the same things. However, they can certainly happen to the same person, and they are not interchangeable terms. So, just so everyone is aware that mental illness is actually quite common. It's one of the most common diagnoses in the United States. If you look at the congregate of all mental disorders diagnosed, it's the largest share of the diagnoses in the United States. More than 50% of people will be diagnosed with a mental illness in their lifetime. So from across the spectrum, 50% of people will be diagnosed with mental illness. There's depression, anxiety, there's, like we talked about, bipolar disorder, schizophrenia. There's a whole slew of other, diseases like PTSD, OCD, autism, which happens. There's a lot of congenital issues that happen to younger kids that have to be managed through their lives. So more than 50% will be diagnosed. 1 in 5 Americans will experience mental illness in any given year. 1 in 5 children, either currently or at some point in their lives, have had a seriously debilitating mental illness. A lot of children are particularly resilient. They get through it. They become strong adults. More often than not, they do very, very well in their lives. And so, it's just important to remember, though, that children are really struggling. And probably in the pandemic with remote learning, there's even greater struggles. And so we really need to help our children through this process of living in a pandemic, and to keep this in mind. And 1 in 25 Americans live with serious mental illness, such as schizophrenia, bipolar disorder, or major depression. To learn more about mental illness in the pandemic, please go to the cdc.gov website, mental health, and learn more. But, I want to bring up the common nature of mental illness, because you would think, given these illnesses being so common, that people would be more aware of them. However, there's unfortunately a lot of stigma around mental illness, and it's not always identified and named, given the shame that people have around these illnesses in their communities. So as this pandemic is unfolding and its many consequences are unraveling our lives, it's very important to note that stress can trigger mental illness, and it's important to take stock of what's going on with ourselves and our families, and maybe take this opportunity to destigmatize mental illness, because it is so common and so many of our family and friends are dealing with it and maybe not able to talk about it. So I wanted to let everybody know that this is probably more common than cardiovascular disease or stroke. So ask your family and friends if they're doing okay. Risk factors for mental illness. So first, we talked about resiliency factors, resiliency traits that help people deal with stress. What are some risk factors now that may make someone more likely to have mental illness? So adverse childhood events are certainly connected to having a future diagnosis of mental illness. So adverse childhood events include physical, sexual, and emotional abuse, neglect, trauma, some type of serious trauma and loss in childhood. Experiences related to chronic medical conditions are risk factors. Biological factors such as genetics or injury to the brain or some shift in brain chemistry can certainly induce mental illness. Having a limited social network, we know that isolation can certainly impact people's mental health, but actually push them into meeting criteria for mental illness. Acute or chronic significant stress. That's key. That's why we're talking about stress so much in this conversation. The use of alcohol and drugs, particularly prolonged use over time, can certainly exacerbate people who have a predisposition to mental illness. And in this pandemic, we're seeing isolation, job loss, lower income individuals, frontline workers. All of these people are experiencing trauma. We know that trauma can trigger mental illness. So it is important for us to be very mindful of the traumas that we're experiencing and taking care of ourselves and our loved ones so that we protect ourselves from mental illness. So I wanted to discuss ways to manage mental illness now if you are experiencing any symptoms of mental illness. And one thing I should say about mental illness is that a lot of people function through their lives with mental illness and have fulfilling lives. And important piece about dealing with mental illness and really knowing when you have to get help is the fact that you're not functioning through the day. If you are not able to really kind of get through the day and your symptoms are debilitating, it is important to consider talking to your doctor about what's going on. Particularly, I think that people are feeling more and more comfortable talking about depression symptoms and anxiety symptoms, but some symptoms people might not be talking about is feeling more paranoid, feeling like people might be after you, or feeling kind of disassociated from reality. When you're starting to have symptoms like that that are making it very difficult to function during the day, it might be important to talk to your doctor sooner rather than later so that they can connect you to the help that you need. Also, considering psychotherapy. A lot of people don't know why therapy could be helpful, and maybe I thought this would be a good time to explain that. Therapy is really good around helping you become aware of your own patterns around what you're doing. A lot of times we get so routine and we're in our own lives and structure and doing the same thing every day that it's very hard for us to notice the patterns that get us into difficult situations and stagnate our lives. Psychotherapy is a way of having that feedback so that you can actually see that maybe the way you're thinking about something doesn't have to be, isn't necessarily parallel to what's going on in the world. So for example, that's what we call a cognitive distortion. So you believe something in your head that actually isn't manifesting in reality. So you might believe like, oh, nobody likes the way I communicate, and everybody dislikes me, everyone hates me. So in therapy, as you go through that process of dealing with, okay, this is this thought that I have in my head, you might start to realize that this is a pattern in your mind and not actually what's reflected in reality. And this can be extraordinarily helpful for people. And everybody has it. Everybody has cognitive distortions about what they believe is reality in their head and what's really going on in life. And it is important to sometimes in therapy be able to actually see those areas in your life where you can change your distortions of thinking. Again, medications are an option. Taking medications for a particular mental illness can be life-changing for people and really put them on the right path. So it's something to an important way to manage mental illness. And there's an app for that. Many health-oriented apps are useful, and we are using them in our therapy sessions with people. So there's tons of mindfulness apps now for meditation, mindfulness, yoga, exercise, helping you time your exercises, keeping track of your exercise and meditation. Those can be very useful. Also keeping track of your mood. If you're trying to track, okay, if these interventions that I'm putting into my life will help my mood, you can actually keep track of your mood on the app and see if you're doing better over time. And that can be really encouraging for people and help enhance their optimism. Right now, mental health visits are more accessible because a lot of mental health professionals are using telehealth and telepsychiatry. So if you do want to now engage in therapy, because you see this is a good time in life to kind of get and deal with some of the issues you've had, is a great way to increase access. So maybe you can do your sessions virtually with therapy, and that can be helpful. As all doctors will tell you, meditation, diet, exercise, social connection, and sleep are all excellent ways to improve your mental health in stressful situations and just generally. So if there's a way you can add these things to your routine, it is the best way to deal with your mental health and grounding yourself. Like we talked about, cut out the news for periods of time during the day. Really focus on the facts. Take walks in nature. Recognize you're still here. The earth is still turning. Things are still moving. We are moving out of this year. There's a vaccine coming. Just grounding yourself in reality can be very helpful. And so what I do want to say, as we come to a close in this conversation, is that there is hope in this story. I know we talked a lot about the anxiety that people are feeling and why there is cause for anxiety, but we must remember that this crisis will end. It is almost over. A pandemic doesn't last for decades. It lasts for a year and a half. I think coming from a health professional perspective, I know that that's how we're all thinking about it, that we do know that this will end. This isn't going to go on forever. It feels like it right now because it's already gone on for so long. And the fact that everybody around us is dealing with the same problem we are, it can feel never ending and really stressful, but it will end. It's almost over. The great majority of people will do well, and you will manage this, and it will not leave a scar in your life. You will handle it. All of us are born with traits of resiliency. And when we enhance our ability to use our resilient traits, we do better. And that's what will happen. And that's what we've seen across disasters and across time, that the great majority of people will do well. Resiliency is the norm, and it's not the exception. We are strengthened by previous adversity, and this one will help us be stronger as a people. And we need to seek out and amplify kindness and generosity. Just when someone is kind to you, be kind back, and also spread it around. Make sure you do something kind for the next person that you see. And that's sort of how we'll change things. Being generous and being kind will help change the trajectory of the pandemic and how we deal with the revolution that is to come after this crisis. And I want to thank you all for your attention. Absolutely, there will be ways to contact me if you have questions. And bring it back to the group.
Well, thank you, Jhilam, for the outstanding presentation. You have given a lot to think, a lot to digest. On behalf of BAGC, I want to really thank you for your time. I know you are very busy, and we really appreciate your time. Let me take a few seconds to talk about the future seminar program. As I mentioned earlier, we will have 3 COVID-related presentations. You heard today one. Next 2 would be, first one, taking care of your physical health during COVID. It would be given by an orthopedic surgeon. Second one is taking care of your spiritual health during COVID-19. It would be given by a renowned spiritual leader in our area. Information will be emailed to you at an appropriate time. Please do join us. We thank you, BAGC members, for attending this tonight's program. Now I would request our president, Jayanta Mukherjee, to make some concluding remarks and close this session. Jayanta, please.
Thank you very much, Deepakda, for introducing me and also organizing this excellent program and presentation from Jhilam. And hope everybody is doing good under this pandemic. And I also want to thank Jhilam for coming and presenting your presentation. This was an awesome, and it will definitely help our community. And it is really, we appreciate that you gave us this much time and this much effort to create all this presentation. And it will be really helpful, and it will be a really memorable one. And I think for us as a community, we will gain from your presentation. Thank you very much. Thank you very much, everybody.